Is your loved one with Parkinson's disease struggling to maintain a healthy weight? Hi, I'm Sneha Hari. I'm a speech language pathologist working at PRS Neurosciences. So here in today's video, we will take a look at the different effects of malnutrition in Parkinson's patients and why each of that is caused. And we'll also look at the possible strategies that we can do to help with this. So some of the main effects of these malnutrition in Parkinson's disease patients are depression, dehydration, cognitive impairments, muscle wasting, unintended weight loss, weak immune system, bone thinning, fractures, falls, etc. Just to name a few of the potential factors. Usually, as you all know, malnutrition has a lot of problems. In Parkinson's disease specifically, these are the common things that are seen. So now we'll go into what causes this malnutrition in Parkinson's disease patients. So like I said, we're going to see the causes. The first cause, as discussed in the previous videos, is dysphagia or swallowing difficulties, chewing difficulties. So like you can think, if there is any difficulty in swallowing, obviously the food that is entering into your body is going to be less, which is definitely going to cause nutritional problems. Similarly, the second problem that can be seen is gastrophoresis, which leads to the slow movement of food into the small intestine. So this movement of food into the small intestine, if it is reduced, the absorption reduces, the absorption of medications reduces. Next cause is constipation. So this constipation is something that can come before the diagnosis of Parkinson's disease. Like the symptom of having constipation is sort of like a predation to the diagnosis of Parkinson's disease, and this increases the risk of colon cancer. So this has to be managed very well, and the feeling of fullness, all of these sort of comes along with this problem. Next problem affecting this is cognitive impairment, which has been discussed in a small extent in a previous video but is going to be discussed in detail in the upcoming videos. So these cognitive abilities, they tend to have some memory issues, they tend to forget things. So this can sort of make them forget taking medications, make them forget that they have eaten. They may have a difficulty to drive, go get groceries and come. They may find difficulty to cook a food and then eat it. So these are how cognition may impact the nutrition. Another thing that we commonly see is fatigue. So this fatigue can be again due to different reasons, can be because of Parkinson's itself, or it can be because of the medications, it can be because of any other sort of thing that relates to fatigue. Similarly, when you are fatigued, when you are sleepy, when you are drowsy, you don't feel like eating, or you may not be able to eat as much as you were eating. So this can again cause nutritional difficulties. Another thing that we see is depression. Again, this is going to be discussed in detail as to how to manage it in an upcoming video. But now we'll look at how it may affect nutrition. So generally, this can be just mild sadness, as you see, or it can even become severe depression. How it affects is generally, if you are depressed, you wouldn't feel like eating. So the diminished food choices may be there. You may not want to eat everything that you see. There will be unplanned weight loss, loss of appetite. You're generally not feeling happy. You won't feel like eating. So that's the same thing that happens here. Another thing is loss of olfaction or the loss of smell. So what happens along with loss of smell is they lose the taste, and this loss of taste obviously will not encourage them to eat more. They sort of lose interest in eating, they lose interest in the taste or having different flavors and such things. Another major reason why people may have malnutrition is medications, or the PD related medications that is very important to take but have these small side effects with it. So they may be dry mouth, they may get nausea and vomiting, they may have unplanned weight gain due to which they purposely not take more. So because of this different things that the medications cause, it may indirectly affect the nutrition of a patient. So there are obviously other things like vitamin deficiencies and many other things that causes this malnutrition, but this is the major different reasons of why it happens. And the management of this is definitely going to vary depending on what problems you have. You may have one problem. If it is related to medications, tweaking your medications may help. If it is related to any other thing, adding any other medications, different management. So each of these problems or causes have a different management strategy. It's not a one size fit all plan that we have for nutrition. So the best thing for you to do is to have a comprehensive evaluation done. Speak to not just a dietitian or a nutritionalist, but also speak to your doctor, speak to your rehab professional, see what do you require, how much endurance you require, and based on your needs, a curative plan has to be kept. A comprehensive plan has to be made for you. So call on this number, book your appointment today, get your consultation done and get your diet plan fixed. Thank you.